Hi, my name is Peyton. This is Jacob.
Hello.
And today we're going to be talking about cavities and how we assess risk using the CAMBRA system.
Okay.
So let's get started. What do you know about how cavities develop?
By not flossing or brushing your teeth.
Okay, and yes, that is part of it. So when we use toothpaste, a lot of them are going to be fluoridated, and we'll talk about that later about how that's beneficial to our enamel. But also when we brush and floss our teeth, we're physically removing biofilm on our tooth surfaces. And as we're also about to talk about in a second, bacteria play a pivotal role in the production of cavities.
Oh.
So how cavities develop and what causes them. So cavities are caused by fermentable carbs, not just sugars, and we call them cariogenic bacteria. So bacteria capable of fermenting these carbohydrates and generating cavities, hence cariogenic. They do this on susceptible tooth surfaces. So this is typically going to be between teeth where we don't floss, and deeper pits and fissures on our back molars.
Okay.
So when these bacteria ferment carbohydrates, they produce acids, and these acids will lower the pH of the mouth, which makes the enamel prone to demineralization, or the loss of minerals, making the tooth more more weak and more prone to cavitation.
Okay.
So when acid is exposed to our tooth surface, our teeth will undergo acid attacks, which leads to tooth mineral loss, aka demineralization.
Okay.
And a great way to summarize this is by looking at an equation that we learned in class. So sugar plus bacteria equals acid, acid plus tooth equals cavities. Kind of make sense?
Yeah.
So that's a good way to summarize it. So essentially every time we snack or drink sugary beverages, we lower the pH of our mouth, and especially between teeth brushing during like the middle of the day, it makes our enamel prone to demineralization. And early dental cavities are not actually cavities, but they're areas of demineralization, and we see these as white spots. And I do have a picture of this. So this is in baby teeth. But do you see those white spots on the tooth surfaces?
Yeah.
So we know as dental hygienists that these are areas of demineralization. So it's kind of like gingivitis is to periodontitis, like we talked about a couple weeks ago. Mm-hmm. White spot lesions are areas of demineralization that have not yet cavitated, but they're reversible. So these earlier stages of cavities, we can reverse by remineralizing the enamel, putting new minerals into that area. Any questions about that?
No.
Okay. So demineralization, these white spot lesions, can be helped and prevented using fluoride. Demineralization can be remineralized using multiple different ways, but the most well-known is fluoride, and we can get this systemically or topically. So we live in an area of fluoridated water, and especially when we're actively creating new teeth and erupting new teeth, that's helpful with creating a strong, healthy foundation of enamel for our tooth. Mm-hmm. But as we already have all of our adult teeth, they've already erupted, topically using fluoridated toothpaste or going in the office and getting varnishes, you've had those before, right?
Mm-hmm. Yeah.
Then the fluoride will enhance remineralization, inhibit demineralization, and also will be taken up by the bacteria on our teeth and will interfere with their acid production, therefore kind of inhibiting cavity formation.
Yeah.
So using fluorides though is necessary throughout life, because as we get older, our teeth will get a lot of wear and tear, making them thinner, and as our enamel gets thinner, it's important to really have healthy, strong enamel to prevent cavitation. Mm-hmm. So using fluoridated toothpaste is essential throughout life. All right, I'm going to determine a preliminary risk for you using the CAMBRA system. Okay.
Okay.
So I'm using my Caries risk assessment form, and can you smile for me, please? So I already know that you have braces, and I can see some bracket spots where it might not have been brushed very well. So that means I'm automatically going to put you at a high risk. Do you have dry mouth?
No.
Okay. So you're not an extreme risk, but I already know you're going to be a high risk. But just to kind of look a little bit more, can you open your mouth wide? So this isn't great lighting, but I can see you have deep pits and fissures. And that kind of looks like looks like this. So you see that deep pit right here, how deep that is?
Yeah.
So think about, if you're chewing, like if you're not brushing well back there, bacteria can get stuck in there, and then sugar can get stuck, and it's just asking for a cavity to occur.
Okay.
And you had braces, but do you have like a retainer?
Yes.
Okay. All right, and then protective factors. I know you live in a fluoridated community. Do you brush with fluoridated toothpaste at least twice a day?
Yeah.
Okay. And do you chew gum?
Yes.
Like xylitol gum?
Yeah.
Okay. And then I know you don't use any of these other things because these are all going to be prescription items, but I'm going to put you at a high-risk category, and that is because you had white spots on your teeth. Do you remember that picture I showed you earlier of those baby teeth with white spots?
Yeah.
They look like that. And as we discussed, these are areas of demineralization, whether that's active or maybe they've been remineralized since then, but we know that those are areas that are going to be more susceptible to cavitation because they've already been demineralized.
Okay.
So that means that I want you to use a couple of strategies to incorporate into your routine to prevent cavities from forming because we know you're at a high risk. So first of all, I'd like you to use a non-abrasive fluoridated toothpaste. And the reason I want it to be non-abrasive is because it's kind of like sandpaper, right? If we're sanding away at our enamel over and over again, we talked about how as we age, enamel gets thinner. We want to prevent that from happening. So use a non-abrasive fluoridated toothpaste to maintain the integrity of a thick enamel. I want you to continue to chew xylitol gum to increase salivary deposits. We didn't talk about it much, but saliva naturally contains a lot of good minerals to mineralize our enamel. So continue using xylitol gum to keep that salivary flow going. And also, I would like you to come in and see me in January when I'm allowed to see prophy patients. And we can continue to assess your risk and also do a reevaluation and see where you're at. So, any questions?
No.
Alrighty.